How can we predict who will be most likely to have withdrawal effects from antidepressants? My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist, and I talk a lot on this channel about the importance of providing full informed consent when starting a psychiatric medication, as well as the concepts of safety prescribing. So the short answer is that we don't really have good data to give clear guidelines on who is at greater risk and who's at less risk of withdrawal symptoms from antidepressants. But there are a few trends and some things we've seen in preliminary papers. So I'll talk about a couple of patient factors and a couple of drug factors. So as far as the medications, we know that medications that have a shorter half-life, this could be things like paroxetine, are much more likely to have withdrawal symptoms than medications with a longer half-life, things like fluoxetine. Additionally, it seems that antidepressants that have more norepinephrine effect tend to also be more challenging to discontinue. So these include things like paroxetine, duloxetine, and venlafaxine. As far as patient factors, the biggest one is probably the duration of time that they've taken the antidepressant. We know that the longer someone has taken an antidepressant, the more challenging it can be to get off of it, and the longer those withdrawal symptoms can last. Additionally, if a patient has had withdrawal symptoms before, so maybe it was just when they went on vacation and they forgot to take their medication, or they've tried to get off the medication before and have had withdrawal symptoms, this predicts increased likelihood of having withdrawal symptoms again. Studies have consistently shown that the diagnosis for which the medication was used does not seem to be correlated with either increased or decreased risk of withdrawal symptoms. If you've experienced withdrawal symptoms from antidepressants before, what do you think? Have these general guidelines been consistent with your experience? Wishing you all good mental health today, and I'll see you in the next one.